Depression is a mood disorder that affects millions of people worldwide. It can affect a person's thoughts, emotions, behaviors, and overall functioning. Depression can occur at any age, but it often begins in adolescence or young adulthood. It is more common in women than men. Depression is caused by a combination of genetic, biological, environmental, and psychological factors. It can be triggered by major life changes, such as the loss of a loved one, relationship problems, financial difficulties, or chronic stress. Sometimes, there may not be an identifiable trigger, and depression can seem to come out of nowhere. Depression can manifest in various ways, and the symptoms can differ from person to person. However, some common signs and symptoms of depression include persistent feelings of sadness, emptiness, or hopelessness. Loss of interest or pleasure in activities that were once enjoyable. Changes in appetite and weight. Sleep disturbances. Fatigue or loss of energy. Difficulty concentrating, making decisions, or remembering things. Feelings of worthlessness or guilt. Thoughts of death or suicide, suicide attempts or self-harm. Irritability, agitation, or restlessness. Physical symptoms, such as headaches or digestive problems, without a clear medical cause. It's important to note that experiencing some of these symptoms doesn't necessarily mean that you have depression. But if you or someone you know is experiencing these symptoms for a prolonged period, it is recommended to seek professional help. The treatment for depression usually involves a combination of different approaches that depend on the severity and type of depression. Here are some of the most common treatments for depression. Psychotherapy. Psychotherapy, also known as talk therapy, is a type of treatment that involves talking to a trained mental health professional. It can help individuals with depression to understand their thoughts and behaviors, develop coping mechanisms, and identify triggers that contribute to their depression. Medication. Antidepressant medications can help balance the chemicals in the brain that regulate mood, reducing symptoms of depression. It is important to note that medications should only be taken under the guidance of a medical professional. Lifestyle changes. Certain lifestyle changes can help improve symptoms of depression. This includes regular exercise, a healthy diet, getting enough sleep, and reducing stress. Support groups. Joining a support group can provide individuals with depression with a sense of community and a safe space to share their experiences and feelings. Alternative therapies. Some alternative therapies, such as acupuncture, meditation, or yoga, can also be helpful in treating depression. It's important to remember that depression is a treatable condition, and with the right combination of treatments and support, most people with depression can lead fulfilling and productive lives.